Hey, so I'm Dr. Hallinan here with Conestoga Oral Surgery. I'll be reviewing some post-operative care instructions with you all. Most oral surgery procedures heal quickly without any significant complications, as long as these precautions are taken. First, we'll discuss pain management. For most procedures, simple over-the-counter medications are usually effective in controlling your pain after your oral surgery. These consist of NSAIDs as well as Tylenol. NSAIDs are most commonly recommended, and we usually prescribe a dose of 600 milligrams of ibuprofen, which should be taken every 6 hours. If needed, you can take 500 milligrams of Tylenol 3 hours after each dose of ibuprofen, as long as you are able to take these medications. Oftentimes, we prescribe narcotic pain medication to deal with severe pain. You always want to be aware of the risks associated while taking these medications. Following your extractions, we usually place sterile gauze over the extraction site. You want to hold firm pressure for 30 minutes while the blood clot forms. After these 30 minutes, the gauze can be removed. As long as there's no significant bleeding after that, you don't have to replace any gauze. If the gauze becomes saturated, or if the area is still bleeding, we'll ask you to replace the gauze for another 30 minutes. If the bleeding is not controlled with simple gauze pressure, what you can do is place a tea bag. There's tannic acid within the tea that helps form a blood clot, and you also hold this in there for 30 minutes. If all of these measures don't work, then feel free to give our office a call to discuss further ways that we can control the bleeding. Gentle rinsing can be performed starting 24 hours after your extraction. Mix 1 teaspoon of salt in a large glass of water and gently rinse your mouth for 30 seconds. This can be done multiple times a day, usually after meals. To limit swelling, we recommend placing ice over the outside of the face where you had these extractions performed. It's usually best done for 20 minutes, and then you take it off for another 20 minutes. You can do this for the first 24 to 48 hours. After this time period, you can switch to some warm, moist heat over the area to help dissipate the swelling. Swelling usually peaks 72 hours or 3 days following the surgery. Until then, it tends to get a little bit worse before it gets better. You want to keep your diet nice and soft after the surgery, sticking with foods that don't break up into small pieces. We like to say avoiding things like popcorn, nuts, seeds, anything that can get dislodged into the extraction sites. There are times when sutures are placed in the extraction site. Most of these sutures are dissolving, and they dissolve in 3 to 5 days. Not every surgery requires a follow-up appointment, but sometimes based on the surgery, one is made. If you experience any worrisome symptoms following the extraction, please contact our office immediately, as we can help. Drowsiness and sedation after the first 24 hours are common. You want to lay down with your head elevated and focus on resting following the procedure. Nausea and vomiting can occur following the procedure, and it's important to let our office know if you're experiencing any of these symptoms. You'll want to focus on hydration and resume with soft diets after the resolution of the nausea and vomiting. We're so happy that you chose Conestoga to have your procedures performed. If you have any questions at all, always feel free to contact us, as we're easily reachable.